Well, welcome back, everyone. We have Micah Sobota here. He's the Director of Crisis Stabilization Unit at Coleman Health Services. Welcome, Micah.
Oh, thank you for having me, Corey.
All right, so it is Mental Health Awareness Month. Explain that to us.
Well, it's just a time that we highlight, not only with Coleman, but the Mental Health and Recovery Board. You're going to see green shirts everywhere, but BC wearing green. It's there to highlight the mental health and addiction, to help destigmatize not only the disease states with mental health and addiction, but also its treatment. And that's exactly what we do here within Coleman Health Services, is focus on the treatment. It starts right from the beginning. We can call in we are here for the community. We can call in and talk to someone, and that is where the Hope line, 1-800-567-HOPE, or 988, easily remembered with 988. Call in at the Hope line, talk with somebody. If we are in need of crisis services, and that's where I as the director, we have our crisis stabilization unit. It is a 15-bed unit for those battling mental health and addiction, and there for the crisis scene. That is our Golden Gate Bridge. That is for the community to get to, like, the crisis center, ultimately to receive outpatient services. And I think that's one of the coolest areas within Coleman Health Services. We have our crisis center. Not every community has a crisis center, but we have our crisis center, and we have so many awesome programs within Coleman Health Services on an outpatient basis after the crisis center. One area is that I also am a director of and team lead is the first episode psychosis program. It's where we utilize best practices. And as a pharmacist, I realize I wish I could give just a pill and everybody be all good and everybody be fine. But it's not the case. There's no magic pill for mental health and addiction. We have to use a team-based approach, capture those clients. And that's one of the cool things about the FEP program, or first episode psychosis. Those who have had their first mental health break with psychosis, with either schizophrenia or bipolar disorder, we get a team around them. And it's not just a psychiatrist. We have counseling. We have case management. We have family psychoeducation, peer support, and employment specialists. We get that whole team wrapped around the patient and their family for the best outcomes and the best success.
Yeah, Michael, I have to say that, for a long time, nobody really talked about mental health. Nobody understood it, and you did say, it's like the awareness of it is becoming more prevalent nowadays because people are talking about it. They are becoming aware. And so the services like what you have there are such a great access to our community. It's good to have you here around.
We truly appreciate it. And I think that is the basic thing. We are here for the community.
Yeah.
And I want that to be known.
Yeah, well, like I said, if anybody, would ever need any help, you're there to assist, and we appreciate you coming on today, Micah. I really do appreciate it.
Oh, thank you so much, and anytime you need us, we're here for you.
All right. Well, thank you once again, and don't go away because we have more when we return.